Hello and welcome to another beautiful episode of Softline. I'm Nancy Banigo and with me today I have Eddie Young. Eyang. Eddie. How you
If you
doing?
don't do that, I won't talk.
Eddie Young.
Hello, everyone. How are you today? Yeah, we're back for another interesting episode. And trust us, it's going to be very, very educational and informative. So just stay around, call others to join you. It can only be Softline on ADBN TV.
Absolutely.
So now, okay, you agree with me, right?
Yeah, of course. I always agree with you now.
How are you?
I'm fine, thank you. Have you ever thought of this Gen Z, working with the Gen Z, how it is? You know, I saw somewhere where a group of people working in a company were bothered. They were complaining that the management just organized a training for them. And do you know what that training is about? How to behave like the Gen Zs when we talk of workplace culture.
Yeah.
You know, the Gen Z is talking about being technology savvy, fast, know it all, you know. So I was like wondering, it's a big deal now. I now sat down and I looked around. I just know we have some Gen Zs around us, and I began to watch them, and I understood that these people actually work in a different way.
Yeah.
Talk about their dressing, talk about the way they see things. They are quick to solve issues that could take us, longer time to solve. But then there's also some bad downside to this whole Gen Z thing. So I don't know, do you have Gen Zs in your own place?
So you see, when you say there is a downside, there is no life or aspect of life that are not two-sided, Everything about life has a two-coin face to it. So you have the good parts, and you have the downside. So I think the world is fast evolving. We can't help but tag along. If you don't do that, you'll be left behind.
I tell you.
Exactly. But then it's not everything I feel we should imbibe. Yeah. There should be a mix. I don't know if it will ever happen.
Okay.
Where you have a mix of the Gen Z, the Gen A, the Gen Y.
All together in one place.
Exactly. So that there can be space for everybody to at least operate. If not, before you know it, maybe the Gen A will be completely wiped off and then the Gen Z will take over. And they will say it's our turn.
You know, even as much as people talk about this Gen Z, they say, oh, they are this or that. Do you know one downside I'm so bothered about? The lack of patience. They are quick to quit. When they begin to do something and it doesn't work the way they want it, they just quit. And their quitting is not like the millennials or back in the days where you have process to tender in your resignation and all. Some of them do it online. They just go online and send their MDs and I'm done.
So you see that boils down to morals.
Morals?
Yeah. It's not only about a Gen Z thing. It's the part of the Gen A's that should be inculcated into the Gen Z's, which is the moral aspect. So the Gen Z's, for me, they don't think twice, they don't think about the after effect of their actions. They just go ahead, and then if the ripple effect is very negative, they probably come back and say they're sorry.
No, some of them don't even say sorry.
Yeah,
they tell you it's affecting their mental health. They're so big on mental health issues. They are so big on mental health. They quit and tell you this is not just what I want, and then they just give up. So perhaps we just learn how to, indulge them in this aspect.
So for my own worry is etiquette.
Okay.
They really don't have it.
Yeah.
They really
Some
don't.
of them, not
some,
all of them.
not yeah, sure. Some of them, some of them don't really have it. Etiquette, morals, and some of them is just that they don't know. Because I've had an encounter where I couldn't help. I called we're at a restaurant. Two of them walked in to order food takeaway, and then they sat on the chair like it was your father's parlor on the couch, talking in the feet And I'm like, who sits for a lady? Who sits like this in public? I was stuck at, oh, am I going to be embarrassed? Because some of them, they don't take corrections. When you try to point it out to them, they wash it off your face. So I said, okay, let me take it. Let me take the bull by the horn, whatever. But, you know, I was so satisfied. I was so happy I did, because I could see that she was remorseful, so to say. She told me thank you. Even when she was about leaving, she said, thank you, ma. I'm like, okay, so let's hope I've been able to impact one person. And she would also talk to some other person. So I think we should also relent in trying to call them to order when we see them go the extreme. You know, some of them just don't know what they are doing.
Now, who brings them? Who are those people raising this Gen Z? Or
I'm not sure we want to go in there, because we can make this a full episode if we need to do this.
You know, but it's a good thing you had to do that. It's a good thing, because so many persons just jump into conclusion and say these people don't listen. You know, so if you hadn't taken that step, you would have been one of them saying, well, they don't
assumptions.
listen.
Yeah, because I've also had that experience where I called one to correct, and she was like, I know, as in she was very nasty. And I'm like, fine, but I felt satisfied I'd done my part, you know. So
oh, nice one there. We'll go on a very quick break, and we'll come back introducing our topic and our guest. Stay with us. We'll be right back.
Welcome to FCT in Focus, your window to the vibrant heartbeat of Nigeria's capital. We dive deep into the core of the FCT, exploring how key policies and decisions shape lives across the city. From exclusive insights into the FCT administration to voices from the streets, we bring you stories that matter. Catch FCT in Focus every Saturday and Sunday at noon. Tune in for the latest stories directly from the nation's hearts.
Step into the heartbeat of the world, where news meets real talk. From breakthroughs in diplomacy to humanitarian challenges and scientific milestones, Global Digest takes you beyond the headlines and straight to the heart of the matter. I am Amma Marcus. Be a part of the world unfolding stories at 3 p.m. on ADBN, channel 258 on DSTV, and Star Times, channel 140. Global Digest, your window to the world's current affairs, only on Advocate Podcast.
For tuning in. Today we are discussing something truly important yet overlooked: our hearing health. Joining us is Dr. Mfon Inoh, an ENT specialist who's here to share some valuable insights and tips on how to protect our hearing and keep our ears healthy. From loud music to everyday habits, we're going to dive into it all. So let's get started. Dr. Inoh, you're welcome to the show.
Thank you very much, Nancy.
Welcome, Doctor.
Thank you so very much.
Okay,
Thank you.
Dr. Inoh,
yes.
let me ask, is this topic very important?
It's very, very, very important, because hearing loss is becoming a menace in our society. In fact, WHO has projected that by 2050, there are about 2.5 billion persons living with a form of hearing loss.
Wow.
And so we must always discuss this. I know this hearing loss poses a socio-economic hazard, socio-economic challenge to our society. So it's important we deal with it. It's important people recognize it. It's important we treat it.
Now, when we talk of hearing loss, are there some misconceptions people have about it?
Yes.
Okay.
Yes. Now, but let me start with what hearing loss is.
Exactly.
Hearing loss simply means inability to hear.
To hear.
Now, a lot of times people actually come to the hospital when they have what we call disabling hearing loss. So that means that every other, you can have a hearing loss.
Okay.
But if it's not disabling, you might not present to the hospital because you might feel they are still hearing. You understand what I'm talking about? So when they now present to the hospital with a disabling hearing loss, they can't be useful to the society. That means it's already posing a challenge to them at their places of work, in their homes, you know, and then they cannot function well in the society. So that is why it's a problem.
Okay. All right.
So how do we
The
detect
misconceptions.
Yes.
before the misconceptions, how do we detect the early loss of the hearing? Yeah.
That's
Okay.
why it is important that we as ENT surgeons advocate that people should have regular ear checks.
Okay.
So we must be interested in our ear and our hearing. There are two things: your ear, what you see, then the hearing, which is the function of the ear.
Okay.
Yes. So once you're interested in it and you come to the hospital often, and then we check it, there's a test we do, a series of tests to assess one's hearing. Once that is done often, you have to pick when the hearing loss begins.
Okay.
Management can be instituted if possible.
You know why I wanted us to do that misconception? Because, you know, people tend to rule out hospitals except it becomes, just like you say, it's worse. That's what they think about the hospital. So there must have been some misconceptions. It's, oh, okay, it's just this, it's going to go, you know, talks like that.
Now,
if there are any of those.
About misconceptions, generally people don't tend to give attention to their ears unless when the hearing becomes serious. Just like you said. Yes. A lot of people don't care. Simple things like water entering your ear. We see people hitting the ear to get that water out. Now, they won't want to come to the hospital because they feel that it's not just the ear. I can still hear now. You know, things like that. Without knowing that that hearing is actually depreciating and going down as day or as years goes by. That's why I still emphasize that one must check the ear. So the misconception is usually that people feel that the ears are just by the side, and then if you cannot hear what somebody says, just tell the person, can you speak louder, please? And when the person speaks louder and you hear,
Well, when you mention water in the ear, is that supposed to be a problem?
Yes, it's a problem because it's a problem depending on how you manage that event. If you understand what I mean? The water enters the ear and then you can't get the water out.
Okay.
It's a problem.
All right.
Yes. And
All right.
you make that patient or that individual very uncomfortable.
Yeah,
If
absolutely.
you don't know how to get the water out,
It becomes a problem.
it's a problem. Or you get it out wrongly, of course you'll injure the ear.
All right,
How-
Dr.
how
Inoh, we'll go on a
often-
very quick break, and we'll be right back to continue with the discussion. Stay with us.
The overall function of the parliament is adequate representation of their constituents in state echoes to federation.
Removal of fuel subsidy, resources to critical sectors such as education and health. A call to unity and progress of the Federal Republic of Nigeria.
NAS Unplugged is a program that will highlight topical issues from both chambers of the National Assembly, from bills, motions, and constituency projects.
Guys have it.
Catch the program on ADBN TV, Mondays, Wednesdays, and Fridays as we bring you activities of the National Assembly as it affects the people.
During the flood disaster in Maiduguri and its environs.
For increase in the number of judges in the High Court of the Federal Capital Territory, Abuja. The eyes have it.
NAS Unplugged, Mondays, Wednesdays, and Fridays at 8 p.m.
So much for being there. So we'll continue with our doctor. You were explaining about water in the ear. I thought it was just an ordinary thing. I mean, water, it will still come out.
No, water in the ear, yes, to some people might be ordinary, but I mentioned that because depending on how you get the water out, it can become a problem. For example, there's this conception in our society that when water enters the ear, you hit the ear, you jump around and hit the ear, you understand? Hitting the ear will traumatize the ear and can lead to hearing loss. So that's why I said water, simple things as water in the ear. Some people, water will get into the ear and then they will just remain like that. They can't hear again, or they will now start introducing other things, other chemicals into the ear that are corrosive and injurious to the ear. Yes. So, but depending on what is done to the ear at that moment, the water will come out. That's why you need to see the experts.
So like you've rightly said,
Yes.
let's establish, can newborn or at what age can one start visiting an ENT, and then how regular
Yes.
can we do that?
Yes, to see an ENT with regards to the hearing problem, isn't it? Okay, so first let me start this. Let me create this understanding that hearing loss can actually commence even from neonatal age. From neonatal age. But let me even say that hearing begins even when the child is conceived, when the fetus is formed. That fetus can actually hear. You understand? Well, that discussion is for some other day. But let me explain this. So, as a neonate, the neonate hears. If there's a loud sound, the neonate, that's the baby you just gave birth to less than 1 month, is lying down in the room, and then there's a loud sound or there's a sound, and the baby shakes. That means that child is hearing. But if the baby is there at home and then there's a sound, and the baby, you notice the baby is not moving, that tells you that child is not hearing. Do you understand?
Okay.
And that is when you seek care immediately. There's a loud sound, for example, or maybe unless there's a thunder or something very loud, that's when you notice the child just shakes. That tells you there's a problem. Do you understand?
Okay.
Then that grows to when the child is maybe a toddler or something, and then you discover the child cannot talk.
Okay.
There's a delayed speech. That should tell you that there's something wrong with the hearing of that child, because you only speak what you hear. If you cannot hear, that means you cannot make sounds. You don't even understand what the world is like, what the environment is like. And so that is what tells you.
Okay.
And then, so that means, I've said that to mean that even as a neonate, that first year, you can seek to see the experts.
Okay.
You understand? Now, even in the developed world, there's what we call neonatal screening for hearing loss. So as you just give birth to your baby in the hospital, you screen that child.
Okay.
You know, the baby comes, you screen the child to know if the child is hearing. Now, with that kind of hearing test, you don't need the cooperation of the child. So that tells you the baby is hearing. So, you know, it builds confidence in the mother and the father to know that their baby is hearing. You understand? Good.
Okay.
So
Can we
for
talk
adults-
a bit? Okay, go ahead. Go
Yeah,
ahead.
for adults, how?
Yes, for adults, how often? Every 6 months, every year, once you have, as long as you do regular body checks, you should also do your ENT checks.
Okay.
Now, so what we advocate for your medical checks, do it during your birthdays. Do you understand?
Oh, really?
Yes, that should be your birthday gift.
Birthday
You understand?
gift.
Yes, so
Yeah.
don't
Give to
just do-
yourself.
Yes, give to
Yeah.
yourself and then do a medical check. So if your birthday, for example, mine is 16th of April,
Okay.
so every 16th of April, I should be able to do some medical checks for myself. That's the best birthday gift
Yeah,
you can
that's
give
a
to
good
yourself.
way to do it.
You understand? Yes, so during those two, you just set the test you want to do. I need to see the ENT surgeon, I need to do some hair checks, do an audiometry, do a tympanometry, you understand? And so once you do a simple test as audiometry and your hearing is assessed, it tells you, fine, your hearing frequencies, the threshold is within normal range. And you're happy that I'm hearing well.
Yeah,
You
that's
understand?
nice.
So when it begins to go down, you can pick it early and then you begin to care for the ear. Avoiding very loud sounds, avoiding things that can injure the ear and all
Okay,
that, so they
okay.
can live well. With
So
a good
just
hearing.
go ahead. Let's go into lifestyle and ways of.
Yeah, I was actually
avoiding-
going
Going
there.
there, yes.
The
So
strategies
beautiful.
to care for your
Yes,
ears.
strategy number one is that you must avoid anything that injures the ear.
Ah, okay.
Now, let me start from if it's congenital. Congenital is when you are giving birth to like that. And then acquired is when what you have done to acquire the illness. So in terms of congenital anomalies that can develop, or let me say neonatal conditions, when a woman is pregnant, for example,
Okay.
and then the things she can do to cause problems to the baby that can injure the ear, you should avoid medications that are not prescribed by a doctor.
Okay.
Because a lot of medications are ototoxic. Do you understand? So as a pregnant mother, avoid medications that are not prescribed to you by your doctor. That is very important because that can actually injure the hearing of the baby. You can give birth to a child and the child is not hearing. That is one. Two, avoid sickness. Don't allow yourself to be ill. If you fall ill, see the doctor during pregnancy.
Okay.
Because some of the illnesses that can happen can develop as a complication. The complication can be that can affect the baby. You understand? Now to adulthood, infections of the ear must be treated seriously. The child, the individual is complaining of a pain in the ear, in the right ear, in the left ear, make sure you seek medical attention. Because if you do not, one of the commonest causes of hearing loss is a chronic discharging ear. That means an ear that has been discharging for a long time that has not sought medical attention. Do you understand?
When you say discharge, it like water coming out of
Yes,
the
not
ear?
really. We don't call it water. It's a discharge. You understand? Is a
Pus?
pus. Let's use the word pus. And I've read it here. So pus-like substance coming out from the ear.
Okay.
You understand? Because of the infection in that ear. Now, the other habits we do, for example, trauma. A lot of people slap people in the ear. You understand? I've seen a lot of people that have come in I was slapped by the armed forces, and security men, all those, because they, but that's, or by their spouses or something. Good. So trauma to the ear should be avoided.
Okay.
Simple things like introducing objects to the ear. Sometimes sharp objects, yes. I've seen patients that were trying to clean their ear with the comb. Some of these wicked combs with the pointed teeth.
Wicked combs.
And they use them to clean their ear. And that is when their babies will run, their little baby will come to come and hug them. You understand? And then just come to hug them, and then the comb just goes in.
And that is it.
And that is it. You understand? So these are.
How about cotton buds?
Cotton buds. Cotton buds, we don't encourage use of cotton bud. In fact, we don't encourage the use of anything in the ear. We always say the only thing that should enter your ear is your elbow.
How?
So if your elbow cannot enter your canal, that means nothing should enter inside now. You understand? The cotton bud can actually push the wax more inside. The cotton bud can cause trauma to the canal.
Okay.
The cotton bud can fall inside. Do you understand? And then cause trouble. Then, so there are a lot of things. Even drugs. I mentioned drugs. Even as adults, there's some medications we take that injure the ear.
Okay.
Over-the-counter medications are not prescribed by doctors, and it can injure the ear. So loud sound, before I forget, sound. Understand? Yes. Sound is also something that is very common in our society that injures the ear. Yes, injures the hearing. So we must avoid exposing our ears to loud
when you mention
sounds.
loud sound, I wanted to say, because the Gen Zs, we know everybody has their earphones and all that. And I want us to talk about this, because I saw a review somewhere where they said people no longer, it's now dangerous to use the Bluetooth kind of earpiece. People have gone back to using the one with the wire, right? Because it's better. Now I see almost everybody, I see footballers, musicians, everybody have this ear. So with your years of practice, which category of people, because I'm still wondering, are they the ones that have the highest rate of ear infections or ear problem as a result of the earpiece they use?
Well, now, let me say it this way. Loud sounds or continuous exposure to loud sounds is what injures the ear, depending on the decibels, how loud the sound is. Do you understand? However, very loud sounds of up to about 120 decibels, like a blast, sudden blast, can cause a sudden hearing loss. But these other ones, this continuous exposure causes gradual loss of hearing. Now, so it's not just because you're using hearing earpiece. People that are always going to party, exposed to party, going to parties.
Even the church.
They like loud sounds. Now, the church, yes, but the loud sound exposure is that you must be exposed to up to like 8 hours. If it's like 85 decibel sound exposed to, about 8 hours per day for like 1 week or 2 weeks. You understand? Continuous. But in church, that's why sometimes in church, I would say I'm quiet somehow on that one. You might not be exposed constantly to that sound. Even the praise worship might not be up to 8 hours. Do you understand? But however, if you are always fond of sitting very close to the speaker, very those loud, very and then you are now exposed to it, of course it will injure your hearing. But if it is that the sound is there but you're not exposed to it directly, 30 minutes of worship and then it's not very loud, that might not be, you understand, because you allow the ear to relax. So then let's go back to the earpiece before I forget. Now the earpiece, there are different types. We have the one we call over the head, over the ear. Circumoral, the one we wear like this, over the ear. Then you have the headset, good. Then, well, both of them are actually, the earpiece are actually headsets. Yes, both of them are actually headsets. So then you have the one we call in the ear, which is the one we insert inside the ear, understand? Then the one we call in the canal, where you don't even see it, you understand? So the common ones everybody uses now, not only Gen Zs, a lot of people use it. A lot of people use it because the society, the way the world is now, you want to multitask. So you want to be hearing
and driving.
You want to be hearing and talking. You want to be hearing and doing some other things. So you are multitasking. You want to be attending the conference and you are cooking in the kitchen. Do you understand? So you need an earpiece. So the world is actually changing, evolving. So if the earpiece you are using is in the ear and is fitting into the canal in such a way that it has fitted completely and has occluded no other sound, the pressure of the sound cannot even escape. So all the sound that is coming is just getting inside the ear.
Into the head.
Beautiful. And then there are some people that will use those sound sets, and then the sound, you that is by the side, standing by the side of
will be hearing
the sound. You should know that that is very loud. But the good news also is that most of these equipments give warning signs. So if you're increasing the volume higher than normal, You see a
Tells
caution
you.
sign, warning you that
You're
you are going to enjoy your hearing. You understand? So if you want to damage the hearing finally, go ahead and you understand?
Okay.
So that is how it actually works.
All
Okay,
right.
so my concern in all of this is how do people who are exposed, we've talked about church, but there are people who actually earn a living at a production company.
Yes.
And you know they have,
Beautiful.
they can't stay away from
Occupational
noise.
hazard as hearing loss.
Exactly.
Yes, yes.
So how can they prevent themselves? Because they have to
Now,
go to work.
Yes. So for those ones, they know by virtue of their jobs, they're going to be exposed to loud sounds. Good. Before those persons are employed, normally you should do an audiometry. You should do an assessment. So you have what is called a pre-employment hearing assessment. Do you understand? Because those kind of people can sue you. Can sue your company. That is your company that has damaged their hearing. So have a pre-employment hearing assessment on record. Then when they now start working, you must educate those persons on proper care of their ear and hearing. This include that, yes, they are going to work in places that are very loud. You must provide them with PPEs, so ear mufflers and earplugs. And then you must ensure that these persons wear them. Do you understand? Now, because the earplug, the earplug and the ear muffler cancel sounds, can reduce the intensity of the sound for up to about 30 or 40 decibels. Do you understand? So if for example you're exposed to a room that the sound that is generated is about 80 decibels or about 100 decibels, and you're able to cancel about 30 to 40. It's just 70 that the person is exposed to. Then also, you also ensure that the person is not constantly being exposed. So they work in shifts. Maybe instead of keeping them for 8 hours, can make the shift to be 6 hours or 5 hours. Do you understand? So they expose and then come back and then rest the ear. Yes.
All right. So could we just talk about treatment options before we go on the break?
For hearing loss?
Yeah, for hearing loss.
There are lots of treatment options. Now, treatment options, we offer treatment options when you identify that the individual is having a disabling hearing loss. That means the hearing impairment is making the individual, is creating a limitation, you understand, in the patient, in the individual's work. Do you understand? So there's a disability. So for example, the patient has a moderate hearing loss or a moderate to severe hearing loss. Now, what are the treatment options? Depending on what the cause of the hearing loss is, that's where treatment is offered. If it's an infection that has led to it, treat the infection and you hope that the hearing should improve. If it is something blocking the canal or blocking the system, you think the patient will benefit from surgery, offer the patient surgery and the hearing might improve. However, most times, the hearing might not improve even when you do all this. So you might now have to offer the patient hearing aids. Do you understand? Hearing aids are devices that help to increase intensity of sound. So they aid the patient to hear better. It's not as if they correct hearing, but they make life better for the individual, for the person.
So when you take it off, it goes back.
It goes back to normal, yes, because it's just like the normal speaker. So it picks this, that's the microphone, and there's a speaker. So the speaker is what you fit into the canal. So the microphone picks the sound, transmits it to the speaker, then you make the sound better. You understand? So depending on which one you are buying, some hearing aids can be picking all the sounds. Even if it flies passing here, it will pick it. Do you understand? So yes, but thank God with technology, we have AI enhanced hearing aids now that makes so it picks only the individual's the voice that you want to hear. So all the other distractions around, it will not pick. Now there are situations where even the patient might not even benefit from the hearing aid. It gets so bad like that. You might now have to offer the patient what we call a cochlear implant. That is, if the patient has a viable cochlea, if the patient can benefit. Now, if you do all that, the patient cannot even still afford the cochlear implant or cannot benefit. It's one thing to afford, it's another thing to benefit. Because cochlear implant surgeries are over 50 million.
Wow. I'm imagining the process.
Per year. And also depending on whether it's a prelingual surgery or a postlingual. Prelingual is that individual has never heard or has never spoken. Postlingual is that the person was talking normally, and then suddenly he now had this crisis and he cannot hear again. Of course, if you give him sound back, he will be able to continue. But the person that has never heard, if you give him sound, he won't understand what the sound is. So you have to start rehabilitating and teaching. After the cochlear implant, assuming the patient does not benefit from that, then you have to rehabilitate that patient into society. So sign language, so the patient or individual does not become useless in society.
Absolutely.
Do you understand? So these are ways you treat.
Okay.
Yes.
Adi, you want to continue?
I think we should go on a break.
And now, I'm the one moderating this table, please. Don't tell. No, we're not going on a break. We've already done our break. Okay, so let's take some few tweets, Doctor. Perhaps we'll change its trajectory of our discussion. Okay, so we have our tweets here, and the first tweet is from Dr. Chinam. And it says, how to protect your hearing. Don't use headphones for more than 90 minutes each day. Volume should never go beyond 80%. And if others can hear the sound from your earphone, it is too loud.
So that's what we're talking about.
Exactly.
You know? Yes.
Exactly. And a ringing sound in the ear is usually the first sign of hearing loss.
Yes.
A ringing sound.
Yes. Now, you won't say yes. I won't say yes. I won't say no.
Okay.
You understand? Yes. It can be a symptom. It can be an associated symptom of hearing loss, but it doesn't really mean that anytime you have a ringing sound. A ringing sound is, we call it tinnitus.
Tinnitus.
Yes, that's sound originating in the ear.
In the ear. Okay.
Yes. You might not know where it's coming from. It might come from your external ear, from your middle ear, or from your inner ear.
All right, we'll still have more messages. Then Chinos also have another message here. It says, plugging your ear with headphones or earplugs and listening to loud music is damaging your hearing.
Yes.
Hearing damage cannot be recovered.
Yes.
Just thought you should know. Thank you. I try not to listen to music with headphones over volume 50, and I think you should also tell us the recommended volume for listening to music. But let's finish with the tweets. And then the last tweet we have here is from the British. It says, noise at work can cause hearing loss that can be temporary or permanent. People often experience temporary deafness after leaving a noisy place, although hearing recovers within a few hours.
Yes.
Okay, I think you didn't finish that message there. Okay, so we're talking about, this should not be ignored. Okay.
Now, for example, military men, they are working in the field, they are, they're fighting the enemies, and then there's a sudden blast. That's over 125 decibels. That can lock the ears instantly. And you have what they call an immediate loss. And it could be it could resolve with time. So we call it a temporary shift in the hearing threshold. You understand? Then over time that might resolve if you relax the ear and then give some medication. However, sometimes it might not resolve. You understand? Yes, it might not resolve. Or even when it resolves, the ear does not return back to its normal function or to its normal state. So it still boils down to prevention. So we must prevent and live properly. Avoid those things that injure our ear and hearing.
So for the military people,
okay, go ahead.
What are the preventive measures they can use?
Yes, beautiful. I've had instances where I've seen a lot of military men come to me in the clinic, and then the complaint has been hearing loss, they're not hearing well and all that. Well, what I do, you cannot tell a military man to be wearing ear muffler and earplug, because when the enemy comes, you won't hear the enemy.
True.
Do you understand?
True.
Yes. So, but however, if it is the one he's going to shoot, if he's the one to shoot the missile, he's going to prepare for it. That one might not enjoy his hearing because his body is prepared for it. The one that injures the hearing is a sudden, unexpected one that injures the hearing. Of course, that is already a job hazard. There's nothing you're going to advise them. However, when the hearing is injured, what I always do, when I recommend and I give medical reports to them, I always advise that they should bring them off the front line, take them to the rear line, let them walk either from the office or somewhere, understand, so that they can recover properly. Yes, you draw them from the front lines. But that's their job hazard, and they know that.
And those ones they can easily recover, right? Those ones from those loud
They
bands.
might recover, they might not recover. There are a lot of genetic differences. Two persons might be exposed to the same sound. One person goes normal. The other one develops the hearing loss, but they were exposed to the same sounds. Genetic differences.
All right, you remember one of the tweet was talking about volume not more than 50.
Yes.
What's your recommendation?
Well, my recommendation is that just because what is 50 on one set might not be 50 on the other set.
Okay.
So just make sure you are listening to your music at least 1/4, not up to half. Half might even be too much. 1/4, 1/4, or whatever the volume system is. You understand? Let it not be too loud. You understand? Let it not be too loud.
So does sound have anything to do with one's understanding? Because you hear people, if it's not as loud as, they don't seem to appreciate, if it's music, they don't seem to appreciate the music. And all of that. So,
yes, I agree with you. When noise is not loud and, filtered and then the music, you don't tend to enjoy the music. I agree with you. That's why people, when you go to clubs, yes, you said the music is very loud because that's what hits the head, and make you dance, But when you dance, remember that there's a risk that can occur, you understand, with continuous exposure. I'm still using the word continuous exposure. It's not just one exposure that will cause that. Continuous. But however, one single exposure to a blast and damage.
Okay. We started talking about the earpiece. I was wondering, is there a way people use this earpiece wrongly?
Well,
some just putting it outside the ear like this what we have in here, not so much inside the ear. And then sometimes you see it begins to get heated up inside your ear. So is it a sign to take it off?
No. It depends on the model or the earpiece you're using. There's some earpiece that are just attached to the pinner. The pinner is what you see outside here.
Okay.
They're just attached there, and then the volume is just close to the ear. You understand? While there are others that are fitted into the canal. Now, the reason why they are fitted into the canal is so that they can help the earpiece to stay, so it doesn't fall off easily. You understand? So it depends on the make. That's what I'm trying to say.
Okay.
But however, whatever it is, earpieces that are not fitted completely into the canal are better than the ones who fitted completely into the canal. That's why the circumoral earpiece, the one over the head that we wear, are usually better than the one we fit in. Yes, those ones are better. Yes, those ones are better.
Okay, so doctor, I'd like to take you back to care of the ear.
Yes.
So, like you said, if your elbow cannot fit, then nothing. So, from that, there's something that, I think for every person worries them when it has to do with the ear, and that's the wax.
Yes.
How do you manage this?
Wax, yes.
Yeah.
We must know that wax is a blessing. Yes. When I said wax is a blessing, wax has a lot of role it plays in the ear. It helps to lubricate the ear. It helps to trap foreign objects, foreign organisms. It has antibacterial, antifungal properties. However, when wax now become overproduced, that's when it now causes a problem. Hope you understand that. Now, so because that little wax comes out from the canal doesn't mean that there's a problem that's wax. No, wax should be in your ear. If the ear does not have wax, the ear will feel very dry. And once the ear feels dry, it will be very, very inconveniencing. Yes. So now, so how do you take care of the wax? If the wax builds up excessively and occludes the canal, what we recommend is if the wax is not soft, you soften the wax. So you oil the wax. There are ointments we give to the individual to soften the wax. And once the wax is softened, the wax can come out. Okay. The wax refuses to come out. Once you see us in the clinic, we get the wax out. Yes, we'll flush out the wax. But so we do not advocate the use of objects to remove the wax.
So apart from the wax, which I know it's a daily thing people do sometimes.
Yes, to remove, to the wax, to be cleaned. That's what the wax. Yes.
Because I grew up seeing my mom using feathers to tickle her ears. Yes. And that thing can be so,
sweet.
Yes. When you start it,
so that's what people enjoy. It's a sensation, using cotton feather. But we won't pour the saliva on it, then put it, then we'll be doing something like this there,
I'm a corporate.
But you should remember that
so
feather.
Does it have any effect?
Yes. The feather, number one, is not hygienic. The feather most times are picked from the ground.
You wash them now?
Not always. Even when you wash them, you don't wash them with an antiseptic. Do you understand?
True.
Good. So you just put it there and then you introduce infections, and then continuous turning the feather, scratching will cause trauma to the canal. That's where the problem originally arises from. You cause micro trauma, the kind of trauma you might not see with your eyes, but you have injured the skin of the canal. And once you injure the skin of the canal, bacteria can just invade into it. And then that's when you then start having pain. That's why most times, if your ear is itching you and you itch it, after some time, you start feeling pain. You understand? Because you have itched it and you have broken the protection of the skin protection. And so organisms can now pass through that broken barrier and then sets up an infection. And you mean to have ear pain and all that. You mean to say, doctor, the ear was itching me and I was itching it. Then today I cannot even hear. It's paining me severely. That's why you don't advocate that. If the ear is itching you excessively, see a doctor. But however, if your ear is itching you, you can do something like this. Get your finger, touch on your tragus. Tragus is that pointed, this pointed part. And then just touch it outside.
Does it always work?
It should suit. That should be enough. But the one that will require using your pen cover to go in. I can assure you that you will lose consciousness, you will not concentrate one time, and before you know it, it will injure the eardrum.
But what actually causes that itching in the ear?
A lot of things causes itching in the ear.
Okay.
Itching, the ear canal is lined by skin. Just like your outer skin can itch you. Okay. Your ear can also itch you. Now, but remember, even your skin, if your skin itches you abnormally, you know there's a problem. So the same way in the ear. If the ear itches you and you do what I said, it should suit that itching. If it does not, they know that there's a problem. If the frequency of the itching is continuous, know that there's a problem. Now, so what can be the common causes? If the canal is dry, for persons that have used and cleaned their ear and cleaned their ear, that their ear is shiny, or the wax, so the ear is dry. Those kind of persons would recommend that you put oil in the ear. Now, the oil is going, so it's an oil.
When you say oil,
olive oil, you know. Yes, oil. It's just oil the ear.
No palm oil.
No, not palm oil, because palm oil, when palm oil stays, it becomes very sticky. So that one, to remove it, is very difficult. Then there are people that can develop an infection of the ear. The commonest culprit is a fungal infection of the ear, which we call otomycosis. Yes, when you have an itching in the ear that is progressive, you itch, it comes back, you itch, and then sometimes you now be some whitish stuff or blackish stuff will come along with it. You know that is a fungal infection until proven otherwise. However, when you have itching of both ears, as in allergy, so you have itching of the nose, itching of the eyes, itching of the everywhere, the throat, that one is not a fungal infection. That is an allergy. Yes.
So dewaxing neonatal is also a no-no?
No. I see a lot of people when they give birth to babies, they give it, buy cotton board, buy this. The cotton board is not for the ear. I don't know what the cotton board is for. Maybe it's to administer drugs for somewhere, but it's not for the ear. It's a no-no, capital no-no.
Okay. All right. So let's open our phone lines, to see if we can get people asking questions to our doctors, and we'll have our first line here, the 0911-209-7653, and then our second line is 0913-627-5484. 0913-627-5484. Okay, they are there on the screen. Okay, doctor. Now I'm particular about babies, babies and hearing, because we had a sign language educator here some time ago, a few days ago, and she was so concerned with the number of babies, children having hearing problems and all that. So is there signs apart from the ones you do in the hospitals? Because I think it's sometimes could be carelessness on the part of the mothers and all that. So are there those things mothers should look out for?
Yes.
Okay.
Okay, first of all, remember what we said, prevention is key. So for mothers, once you know you have conceived, you are pregnant, avoid medications that are not prescribed by your doctor.
Okay.
That is key.
One.
Avoid alcohol, avoid tobacco, avoid, unless the illness is like you are between the devil and the deep blue sea. That if you don't treat it, something will happen. Then your doctor might decide to just give you the medication, because most times what happens is that you might be taking the medications when the baby is trying to, the parts, the vital organs in the baby are forming, and the drug goes to destroy it. Now that is one. So if you prevent that, that will be fine. Now, if you are giving birth, you're going to give birth to the baby, your baby is baby is growing, and then there are sounds, and then the baby does not kick.
Okay.
That tells you that something is wrong. Something might be wrong.
So a baby is supposed to react to sound even when in the womb?
Yes, now, it's loud sound. When the baby is hearing, baby hears. You don't agree with baby hears? Baby hears. If baby is giving birth and baby is crying, and then nothing can calm the child, and you carry the child and you put the baby on your chest. You just tap the baby. Baby keeps quiet. Why do you think baby keeps quiet? Because baby recognizes the heartbeat that he has been hearing when he was in utero. So baby is calm because now feels that the environment is calm and safe. Keeps quiet. So the baby hears. And so hearing also in the fetus, baby hears. So now I was talking about something. So I've talked about drugs, habits. People drink a lot of things, or you name that. My mother-in-law, my father, or my mother used to do it, give a lot of concussions and then filled with alcohol based, and that destroys the hearing of the child. Now, to when the baby is given birth to, febrile convulsion is something that must be avoided in babies. So we see give birth a baby that is febrile. When I say febrile, has fever.
Okay.
You understand? The fever is so high that the child begins to convulse, begins to have seizures. That seizure can lead to hearing loss. You understand? Or you give birth to the baby, you notice that the eyes of the babies are yellow and all that and all that. And icterus. So those are conditions that can lead to the baby not having lead to hearing loss in the baby. Now, you now give birth to the baby. How do you want to know the baby is hearing? For people that know that are privileged to be exposed to know on her, then they are exposed to the right facilities around them. We have it in the teaching hospital, the University of Your Teaching Hospital. You can screen neonates for hearing loss.
Okay.
So you just get back to the baby. You can bring the baby. You want to be sure that the baby is hearing. Just put in that, apply the appliance on the child, and it gives us reading, and we tell you this baby is hearing.
Okay, so now the point is this a regular check, or is this something you have to request for?
No, it's not a regular check for now, because this is Africa now. If you make it compulsory, people begin to shout that no, God is in this matter. My baby is hearing. Do you understand? So it's not a regular check. If you demand for it for now, we offer it for you. But I'm trying to tell us that we have that facility in the hospital. Now, so assuming that you don't come for that screening, you just take your baby home. So there are two ways you know that the baby is hearing. One was what I said, sounds. You notice that the door opens, the baby should shake. You understand? You just called, everybody's happy. You just want to say, baby, child should just move a little. That tells you the baby is hearing. Or the baby was sleeping quietly, then he just entered and then there was just a sound. The baby should shake. That tells you the baby is hearing. But if all this happens and the baby is not shaking, that baby is not hearing. Then we now go ahead. Baby gets to 2 months. They expect the baby to be producing some babbling sounds. So, ba ba da da ba ba, and baby is not making those sounds. That tells you that baby is not hearing. No. So when you expect the baby to have been saying, mommy or mama or daddy, baby is not making that sound. That baby is not hearing. By that time, it's already late because you have not picked it. Do you understand? So some people still wait and still say the baby will still be here. Will hear. You understand? Or the baby is having delayed speech.
Okay.
Do you understand? When the problem is the delayed speech is actually because the baby is not hearing.
Wow.
Do you understand? So these are ways you actually pick and know if the baby is hearing. From that neonatal, the baby is moving to sounds, you understand, to whether the speech is delayed or not. I didn't say that the causes of delayed speech is only hearing loss. Other causes are there. Beautiful.
Okay. All right. So in your course of practice, how the people you've seen with that come down mostly with this hearing problem, which sector of the economy is it? Is it the women, children? Not even that. I mean, is it like the musicians? Is it like the, I don't know.
Well,
statistics
come to us. I want to say elderlies.
Okay.
Yes.
Which is understandable.
Yes, elderlies. The elderlies come more. If you want to look at the percentage, most, because of course, from 65, age 65, most will begin to come down with hearing loss. A condition we call, naturally, condition we call presbycusis.
Okay.
Yes. Now, this is because depending on what kind of activity the individual was exposed to in his younger age, when he was young, maybe it was the type that was exposed to very loud sound, dancing, or maybe by virtue of his occupation was exposed to loud sound, and then he was having the injury continuously. So the elderly, yes. Then the younger ones, the reason why they might come down with hearing loss is untreated ear infections. Now let me rephrase. Untreated middle ear infection, because if you have an outer ear infection, that might not cause a hearing loss. So middle ear infections, so of which we call otitis media. Once you don't treat it and it has lingered for a long time.
Do you see more of that?
Yes, you see them in the hospital. But however, the frequency might not be that alarming because people can access antibiotics easily now. So someone has a pain in the ear. Of course, you go to the pharmacist first and say, I need something. Then they just give you something, So that has reduced, yes, the incidents, what we see in the hospital. Yes.
So are there supplements one can take to help, boost, and prevent all of this?
For me, supplements. I don't believe in supplements.
Yeah, a doctor now. That is.
So I believe that the food you eat, you understand, contains enough supplements. There are enough vitamins in the food you eat, and enough, whatever you need, amino acids and whatever in your food. So proper care of your ear and hearing is what you actually need So avoid it. So avoid the do's and don'ts. Once you avoid the do's and don'ts, you will.
Okay.
Understand?
All right.
You know why I had to ask that?
Yes.
That's so that for the elderly,
Yes.
where you say at
Beautiful.
that age,
At that age, yes.
could they take supplements so
Okay.
that while
Boost
they're
their immune.
aging?
Now, I
it
won't want
could
to call it
be
supplements. We give them vitamins.
Vitamins, okay.
And I won't want to say supplements because you
Okay.
know supplements. You don't know what they've
Supplements,
added inside the hair. So, but there's some specific vitamins.
Okay.
Now, the vitamins we give normally is one we call we give vitamin B. We give them nicotinic acid. Now, the aim is that it helps to improve the blood supply. You understand? To the hearing part of the ear. So that's why we give them that. You understand? Just to help it. It's not as if when you give that it's going to resolve the condition completely, but it might just help to
Okay.
keep it going. Yes.
All right. Thank you so much, doctor. But somebody said if you have itchy ears,
Yes.
often it's a lack of a particular vitamins in the body.
False.
Oh, false. You see, those are some of the misconceptions I was
False.
talking about.
False. Yes. False. Because lack of vitamins should not be. If it's lack of vitamins, it should not only be the ear. It should be affecting
All
other
over
part
the
of your
body.
skin. Yes, other part of the body. But if it's just the ear, the commonest cause of continuous itching of the ear is a fungal infection of the ear.
All right.
Yes.
I hear we'll have a call. Okay, we still have 2 minutes. We'll have Indi Fereke calling from Uyo. Can we have him online? Hello, Indi Fereke.
Hi, good afternoon.
Good afternoon.
Okay, I'm enjoying the program and you're doing a great job.
Thank you.
Kudos to you and the doctors.
Thank you.
Okay, I had an issue with my hair recently, and I went to the pharmacy and they did some hair syringing, but the stuff that got stuck did not come out completely. And though I spoke with the doctor and he did not recommend using hydrogen peroxide, but the pharmacist did not have any issue with that. He used it yesterday, but I still have that stuff stuck in my hair. I don't know what you would recommend the doctor to.
Okay, I'm going to offer the Freke a personal invitation.
Okay.
If she can come to the clinic on Monday or Tuesday, I will personally attend to her and solve that
Okay.
problem. But what I want to advise is this. It's a common norm and it's wrong. You can't use hydrogen peroxide in the ear. Hydrogen peroxide is corrosive. A lot of times you hear people say they want to wash the ear and they add hydrogen peroxide. You know, we put hydrogen peroxide in this cup and add water, it foams. So you now feel with the foam that you're washing the
It
ear.
brings out the
but it's
dirt to the ear.
corrosive. It's corrosive. So by the time you do that, it's going to injure the canal. In fact, it will worsen the condition. So I don't know why people do it.
Wow.
You understand? So, but for the Freke, I want to offer a personal.
I hope Indi Fereke is listening.
Yes. So
you're
you
being
can find a way
invited.
to Children's
to
on Monday
visit.
or to the ENT clinic.
Okay.
Just when you come, look for Dr. Inoh. Tell me you're the person that called.
On
I will look at that ear for you.
All right,
and we'll
there you
solve that
have it, Indi
problem.
Fereke.
Yes.
If you're listening, or she said she's watching.
Yes.
So you have a free invitation Monday
Or Tuesday. Next week.
A time? Is there a time frame?
Between 9 and 12.
All right, there
Yes.
you go. All right, thank you so much,
Thank you so
Dr.
much,
Inoh, for
ma'am.
coming on the show
Thank you
today.
so much, ma'am.
It's quite
Thank you. Thank you. It's a
impactful.
privilege.
Yeah.
Yes, keep on with the good work.
Thank you so
Thank
much.
you.
All right, that wraps it. To everyone tuning in, thanks for joining us today. And remember to prioritize hearing health. It is a vital part of your overall well-being. So until next time, stay safe and take care of those ears. Thank you so much, Doctor.
Thank you.